Hi guys, my name's John. I'm 59 years old, and like many people of my generation, I had a lot of dental work when I was younger. The old dental van would come around to school and so on. And I had a love for chocolate and Coca-Cola. And as a result of that, my teeth came out the worse for wear. So for about 10 years or more now, prior to me having the process done, I had a small denture to start with, and that ended up becoming a full upper denture. And for anyone who's had one of those, life's no fun. There's a lot of maintenance, a lot of care. You're very limited in what you can eat. You're constantly trying to glue the thing in and keep it in, and then you've got to take it out at night and clean it and back in the morning, and it affects the shape of your face, and just goes on and on and on. And they are, they're just not good. And I was told I'd never want to get a lower denture because they're even worse. And so I got reached a point about 2 years ago now, 18 months, where full upper plate and only about 6, maybe 7 teeth left on the bottom. And it was severely restricting the quality of my life, what I could eat. It was a constant source of problem for me, and it was something that I wanted to deal with. I did a lot of research. I went very close to going to Thailand because it's cheap. I also found out it's cheap for a good reason, because it's nasty. And you might walk out feeling good, but invariably within a few years you'll have problems. So found a place here in Australia, in Perth, the Malay Clinic, and came down to Perth. I live in Broome, West Australia. Came down for a visit, met the team, very happy with everything, very good, absolutely wonderful, comprehensive evaluation, very informative. There was no ums and ahs. They told you straight up what you're looking at, the process, time, cost, and the like. Now, there's no question it's a rude shock when you find out the costs of the process, but I think you have to weigh up that cost versus the quality of your life and the improvements you'll get. And I, for one, will vouch that it's worth every cent. I had the process done in August 2016, and I cannot be happier. It was exactly as they said it would be. Within 48 hours of having my remaining teeth out, I had my new teeth in. Yes, there was swelling, yes, there was a bit of bleeding and so on, but there was no real pain. I had some discomfort initially, a little bit of swelling and so on, but that was managed, and within a few days I was able to eat soft foods. That's a big deal with a lot of people. You are restricted for up to 10 or 12 weeks, I think from memory, that you have a soft diet. Now, I wouldn't panic too much about that. You're going to still eat mince and pasta, and there's soups, and there's any number of things you could eat. So, from what I understand, most people don't mind it because they lose a little bit of weight during that period, but generally speaking, I had no issues. And I found before the 10 or 12 weeks out, I was able to eat toast, start eating slightly further foods. So it's just a matter of letting the teeth let the implants get strong, and you'll be pleasantly surprised at the end of the day. You can eat anything, i.e. there's nothing I can't eat. I can eat pork crackling, the hardest boiled lollies in the world. I've had no issues at all. It is a joy to have a full mouth full of teeth that you can chew on properly. I have no doubt my nutrition's better because I'm chewing my food better. And so all around, I could not be happy. Maintenance of the teeth is a priority. You don't go spending this sort of money and then not maintaining them. But it's not a big deal. The biggest and the most beautiful tool that they'll give you to care for your teeth is the water pick. Because the nature of the implant is such that they fit so well in your mouth that very little stuff gets in behind them, and you'll find if you regularly use the water pick, you will rid your mouth of all foreign food matter. Yes, you should be encouraged to use the floss because it helps get in underneath the plate and also cleans around the posts. You'll have an annual cleaning of the teeth and the posts. It's not an uncomfortable process. They simply unscrew the teeth, take them out, take them away and clean them, clean around the posts. It's no different than a normal cleaning session you might have with your dentist. It takes about an hour, the whole thing, and it's a one annual checkup, a bit like a grease and oil change for your car. And I really, just cannot encourage anyone that's having long-term dental problems to give serious consideration to this, because it is, unlike many other dental treatments, this is the one-off. You do this and you will no longer have any dental concerns. You're never going to have another root canal. You're never going to have a toothache. You're never going to have any of those issues. No gum disease, none of that. Just beautiful looking teeth that are very functional.